There's a class of medications that's being increasingly used for women who have estrogen receptor-positive breast cancer, meaning cancers that need estrogen to grow. Now, traditionally, we were only using medications that would interact only with that receptor, the estrogen receptor. And what we know now is that there's a new class of medications called CD4, CD6 inhibitors, and these work synergistically with some of the hormone therapies that we already use, like aromatase inhibitors, to help decrease the spread of metastatic breast cancer. Aromatase inhibitors inhibit an enzyme called aromatase, which means that you're actually making less estrogen. CD4, CD6 inhibitors are working with estrogen receptor blockers like aromatase inhibitors to help decrease the amount of estrogen that can be taken up into a cancer cell and decrease the growth rate that a cancer cell can grow and expand. So what we know about CD4, CD6 inhibitors is that for women with metastatic estrogen receptor positive, HER2 negative breast cancer, that CD4, CD6 inhibitors can improve what we call their progression-free survival. Progression-free survival means how long they live before the cancer comes back. And that's really important for patients. We also know that for premenopausal women, there was recently a study that showed that one of the CD4, CD6 inhibitors can actually improve a woman's overall survival from the breast cancer. So there are several different CD4, CD6 inhibitors that are on the market, each with a slightly different side effect profile and each requiring different types of monitoring. The key thing to know is that for the most part, these medications are very well tolerated. They are oral, so there's nothing IV, it's all by mouth. And for the most part, the side effects that patients can face on these drugs are usually very well managed and can be managed either with additional medications or sometimes just by lowering the dose of the medication that you're on.